I am Prince John Baoy, a second-year nursing student, and I will be performing this video for catheterization for female patients. So first thing to do is to assessment to overall condition, which includes her consciousness on ability to participate in the procedure. And the next is to determine when was the last time our patient voided or urinated. Then we forecast the bladder for distension and fullness. Then next is to assess the external female genitalia for redness or any kind of this skin breakdown, discoloration, odor, and even the discomfort of the patient. And the next is to assess for any kind of discharges and drainage and tenderness for any localized area. Next is to planning. So as a nurse, it's our responsibility to always verify the physician's order before conducting any procedure. Then we prepare the client for the materials and for this procedure. So ideally, the position of the client must be supine with their legs extended slightly adapted. So for the rationale for this is to easy access the urethral meatus and successfully perform the catheterization. After introducing the client and identifying the patient identity by letting them state their name, we then explain the procedure, why it is necessary for them to cooperate, because it might be the physician ordered the catheterization because the patient bladder is distended or there's a need to obtain a urine specimen. Detail our patient honestly during this procedure. This will be the next, that it might be painful but can be tolerable. So next is to provide privacy to the patient, closing the curtains, so closing the doors, and by dripping them, only exposing the female genitalia, and then properly exposing only the female genitalia, then formally start the procedure. So we must do the hand hygiene. These sides are right over here, the sterile, which is the sterile field and well. So after inserting we are wearing the gloves. So make sure you are not touching anything now. So next is to drop our client in waterproof pad, so under her buttocks. Under her buttocks of our client. So make sure not gonna touch anything. Okay, so restricted grip. So only expose only the female genitalia. So we will now proceed to the cleansing of the meatus. So with the cotton balls using in the forceps. So your non-dominant hand were used to spread the labia. So your dominant hands are used to spread the labia. So while the sterile hands are used to pick the cotton ball with the forceps, so firmly spread the labia with the dominant hand. So techniques to cleanse the meatus is from farthest to nearest into antero-posterior direction up to bottom, then wipe. First here. So we're gonna use other cotton so in the middle up to bottom, then wipe. Okay. In the meatus, we will now proceed to the insertion of the catheter. So the size of the female catheter is French 12 to 14, and the length of the insertion should be around 3 to 4 inches. So I will start holding the catheter like holding a pen. So I'm gonna spread the labia to expose the urethra. So to properly insert the catheter, so It's just supposed to be, I have done lubricating this catheter. So I want to insert the catheter into the urethra, and so this now we will instructing our patient to inhale and exhale, and she inhale serves as instructions, and she exhales starts the time that we insert the catheter. And you'll be so if you're really feeling resistance, is that okay? So we will just continually instructing the patients to inhale and exhale. So inhale, so exhale, ma'am. And then, so after inserting around 3 to 4 inches, you will have observed the urine flow. That the time that we will further more advanced around 1 to 2 inches to properly anchor the balloon. So after 1 to 2 inches, we will now be inflating the balloon with the sterile hand inflate with the 10 ml. If there are resistant, that means anchored, so that means it anchors to the bladder. Successfully inserted the catheter inside the urinary bladder, so that is properly anchored. So we will now place the collection bag just below the hip to prevent ascending backflow. Okay, so you must tape the tube at the inner tight to prevent tension to pressure in the urethra. Bag just below the hip of the bed frame, not the bed, because bed rail tends to move. Before taking off the gloves, so after proper disposal and removal of gloves, we will now assisting our patient to a comfortable position. We will now dripping them and cover the genita. And after that, we will now be documenting the catheter procedure, which includes the dates, and the time, the catheter size, the client's reactions, the characteristics, and the amount of urine specimen. So this will be the end of the video. So thank you for watching.